our project is on responding to joint attention and language development, and we found this study in the Journal of Speech, Language, and Hearing Research.
So what is joint attention and locating targets? Joint attention is when two individuals share action on the same object or task. Children will present joint attention at 12 months. Joint attention is important as it imparts a foundation for language development and provides the basis for reciprocal communication. Locating targets, seeing a target object within or outside your visual field, is an important aspect of joint attention. Before 12 months, responding to joint attention is typically limited to targets within the infant's visual field. Between the ages of 12 and 18 months, the infants develop the capacity to locate targets that are outside their visual field or behind them. Infants' ability to target certain locations reflect increased attention, symbolic thinking, and social cognition that will result in language learning. An example of joint attention would be a child pointing at an apple and telling the teacher to look at it, and the teacher will look at the apple, but then the child will look back at the teacher to make sure that the teacher is also looking at the apple.
So, some background: the infant's ability to respond to joint attention shows developmental milestones, which reflect social, cognitive, and self regulatory skills that assist in acquiring language. Studies conducted by Marcus and colleagues show that differences in 6 to 18-month-old infants that correctly respond to joint attention predict future language skills. However, past studies do not take target location into account during research. This study focuses on joint attention and its effects on language development while taking target location into account.
So the abstract, this study's purpose was to examine locating targets and joint attention skills and their effect on developing language. It was hypothesized that joint attention skills would improve social cognition skills, which allow infants to understand gaze, shift, and gestures. The study specified that for infants 12 months and older, advanced target location skills can lead to stronger language development.
Okay, so for the methodology, 47 infants, 22 boys, and 25 girls were gathered for this study, and all the families were classified as middle class, maintained a high socioeconomic status, and stemmed from various ethnic backgrounds. Infants at 15 months were assessed on joint attention using the early social communication skills, and brightly colored cartoon characters were placed on the left, right, left behind, and right behind of the child, which functioned as targets. The ESCs were administered through two sets of four-pointing trials where the experiments are pointed and looked at each target. Individual trials for left, right, and behind were calculated depending on if the infant turned to each target that the examiner pointed at. For each target to be considered correct, the infant's gaze needed to look beyond the tester's pointer finger.
So a continuation of the methodology. So all the trials were videotaped and coded by two different coders. For results to be counted towards the study, both coders need to demonstrate 94% agreement. Any errors found by the coders were eliminated. Regarding the responding to joint attention trials, the coders found 95% of the trials to be administered properly. Language ability was assessed using the Renal Developmental Language Scales, or RDLS. The infant's receptive language scores were equal to the verbal compression scale. The infant's expressive language scores were calculated using the total scores for structure and vocabulary scales. General cognition level of infants were evaluated using the Bayley Scales of Infant Development 2, or BSID 2. These tests were administered like standardized tests, giving an index score for development. Both the examiners for the assessment were unaware of the joint attention scores.
Okay, so this picture shows how the experiment was carried out. So as you can see, you have the class with the recording equipment behind the class, and then you have the examiner at the table with various toys next to him, and then the parent and child are in front of the table, the child's on the parent's lap, and then surrounding the child, you have the different cartoon character pictures, which the examiner would point to at different times, and you would have to see if the child would locate the target based on the examiner's point.
So these are the results. So for the scores of each test were collected to find the mean, standard deviation, minimum of correctness, and maximum of correctness. For joint attention, which is this first section, the left and right trials showed an 84% mean, a standard deviation of 22.38, a minimum of 25 and a maximum of 100. For behind trials, the mean was 39.43. The standard deviation was 39.61. The minimum was 0 and the maximum was 100. And then they totaled these all together to show that 62.35 was the mean for both tests combined. 25.90 was the standard deviations for both trials. Then the minimum was 12.50 and the maximum was 100. And these results show that 45 out of the 47 infants that were tested had significantly higher scores on their left and right trials than their behind trials. And then the next section is the BSD2. So for the MDI, which is a point, like one of the trials in this test, the mean was 101.73, a standard deviation of 9. 83 was the minimum, and then 117 was the maximum. And then for the RDLS, which would be your receptive and expressive total, for receptive language, they have a mean of 20.57, a standard deviation of 8.02, a minimum of 3, and a maximum of 34. And then expressive language had a 23.36 of that was the mean, and then the standard deviation was 5.16, and then the minimum was 12, and then maximum of 32. And since the receptive language and the expressive language are so correlated, they had the scores individually so that you can see the difference between receptive language and expressive language.
Okay, so the main limitation found in the study were surrounding the developmental stages of each infant. So, differing developmental stages among the infants reduce the variability for all the trials. These changes limit the ability to see the relationship between responding to joint attention and language development. However, the findings in the behind trials allowed examiners to come to distinct conclusions. Researchers believe that for clinical treatment, future research needs to be conducted in order to determine if developmental stages affect responding to joint attention and language development.
So implications. So responding to joint attention is effective in cognition and predicts vocabulary development. It's important to take this into account when studying language development. Behind trials, results reflect that with advanced social cognitive skills at younger age, children will have an advanced vocabulary. Infants' ability to correctly locate targets reflects an understanding of pragmatics and the ability to understand where things are compared to the body. These skills will then further increase spatial skills, which allow children to understand more vocabulary words such as over and under. And overall, the results of the study proved the hypothesis to be correct that joint attention and target location plays a pivotal role in language development. And then these are just our references.